My name is Ron Taubman. I'm currently do not have a working organ, but I did get a kidney pancreas transplant at UCLA in 2001 that lasted 9 years. Failed in 2009, and in 2010 I got a second kidney transplant at the University of Arizona in Tucson, Arizona, from a 75-year-old donor. And that kidney just stopped working now after 5 years, and I am currently going all over the place getting relisted for another kidney. I'm 70 years old. When I first got my first transplant, I was 55, I guess. So, and my experience with the post-transplant kidney transplant has been extensive. After 6 months after the first transplant, I had my first basal cell carcinoma on my nose. Seems to like my nose a lot. Then I had a rash of them on the nose, on the face, even on the ear, which were pretty much all removed by Mohs surgery. So after 9 years, when I lost my kidney pancreas and went on and got my second kidney in 2010, a year after receiving the kidney, I got an adenocarcinoma, which is a squamous cell tumor in my top left lobe. It was only 1 centimeter. They did what they call a wedge resection, got it out. I had 2 days of limited radiation, and then they put me on a new immunosuppressant drug that has kept me basal cell and squamous cell free for 5 years on my face or on my body. So it's a big problem with all types of transplants, not just kidney. You've got to really watch yourself, follow your doctor's advice of not going out in the sun without any adequate protection, because you've got this gift of life and you're supposed to take care of it, and this is just another facet of taking care of that organ. Okay? Well, what I've learned is when you're getting a transplant, they do talk about the adverse effects of the immunosuppressants and the possibility of skin cancer. But when you had your transplant, it's really up to you to be proactive. When you're released from the transplant hospital, go back to your regular physician to insist, and this is just me, but I have to see a dermatologist at least once every 6 months. And you have to push for it sometimes. Some of the HMO organizations don't want to do that, or they don't want to refer you, they want your regular doctor to look at you, but it's really important that you take this step to push for it and get it and see a dermatologist that's experienced in transplantation dermatology. In 2011, after my second transplant, I was walking in a parking lot, tripped over one of those concrete buffers in the parking lots, fell on my face and chest, ended up in an emergency hospital. As they were wheeling me in, the ER doctor on call came out, and he says, "Oh, okay." He says, "Well, we'll do an x-ray and see if you broke a rib." He says, "Wait a minute, you're a transplant recipient." He says, "I think I'm going to do a CAT scan on you just to be safe." And he did, and he found this 1 centimeter adenocarcinoma in my top left lobe. Very, very early stage. If I wouldn't have tripped, I wouldn't have found it, okay? So somebody was looking after me. They took it out a week later, and I'm fine. I've just celebrated my 5th year, and I've had no problems with it. But you've got to be aware that this possibility does exist if you're a transplant recipient. So, always talk to your doctors and make sure that they're aware of your concern. So, maybe you should go once a year and get at least a chest x-ray or something where they can follow up, but a better protocol to follow up on the possibilities of cancer. Perfect. I'm Ron Taubman. I'm 70 years old. and I'm from California. I live in an area of the San Fernando Valley known as Santa Clarita, which is beautiful. We have hills, coyotes, bunnies, and roadrunners, okay?